everyone, Dr. Lee here. And today I'm going to answer a question that I get asked all the time, and it is, what are my options for missing tooth? And missing teeth are very common. People lose teeth for various reasons, including trauma, cavity, gum disease. And your options are basically about four to five. And I'm going to explain each one. The first option you have for missing tooth is to do an implant. And implants are great because it's the closest thing that acts and looks like your natural tooth. So that's awesome. The negatives to an implant is that sometimes it takes time. Sometimes we have to prepare the bone that will take the implant. Sometimes after we place an implant, we have to wait some months. But other times we can also place implants on the same day. So it depends on your situation and what you have. A second option for missing teeth is to do a bridge. So the good thing about a bridge is that it's quick and it's aesthetic. So it will look like your natural teeth. But the only negative to a bridge, I would say, is that it's difficult to clean because the bridge is basically crown here, crown here, and if this is the missing tooth, there's a crown here that's connected to both these crowns. And it can cause gum problems. I've seen sometimes when we grind down the teeth that are neighboring to make those crowns, sometimes they can end up sensitive. And if they're perfectly healthy teeth, you don't want to have to shave them down just to take a bridge. So those are the negatives to a bridge. Your third option is to do a partial denture. Partial denture, I'm sure everyone knows what a denture is. The pros to a denture is that it's the most economic way to replace missing teeth. And sometimes we do it as a transition. But also something that you also have to think about when you're considering getting a partial denture for permanent use is that it can look a little bit unnatural, and sometimes people find it very uncomfortable to be wearing all the time. So that's something that you need to consider. Another option, which I don't recommend, is to do nothing. And here's why you don't want to do nothing when you're missing a tooth. We have multiple issues that arise from doing nothing. But the first one is that you can cause mesial drift, which if there's an empty space here and you have a tooth behind it, over time this tooth will shift and it will push towards the midline of your mouth. Another big issue that I see with doing nothing is super eruption. So if you're missing a tooth here, let's say, and you have a tooth on the top, it will continue to grow down into that space over time. So you're going to have everything kind of shifting and getting unbalanced. Same thing for the bottom teeth. If there's nothing biting on top of it, it will grow up. So that's called super eruption. Another issue with doing nothing is bone loss. So if you don't get a bone graft after an extraction, what happens naturally is during the healing process will kind of shrink. The bone will shrink. And if you later on decide to get an implant and you didn't do a bone graft, then you're kind of stuck. Sometimes we have to do many surgeries to build up the bone again. So that's another reason why you don't want to do nothing. Another one is sometimes it causes an unbalanced bite. If the person is missing many teeth on the right side, they chew all of their foods on the left side. What happens over time is that causes issues in your joints and your TMJ. If you have a missing tooth, or if you are going to be missing a tooth, if you know somebody who is missing a tooth, it's best to get professional advice and make sure that it's something that is closely followed. So please give us a call if you need a consultation. We are here for you, and we'll see you soon. Thank you. Bye.